Bismillahirrahmanirrahim. I'm Muhammad Sadil Islam Sharkar, again in front of you to discuss some important aspects of herd immunity again, especially the challenges of the herd immunity, contravention of the herd immunity. For example, if we say what are the challenges in creating herd immunity, or if you say what are the contravention in creating herd immunity. This is one of the important topic that I will discuss today. And another one is why would not herd immunity save us from the COVID-19 pandemic? Why wouldn't herd immunity protect us, especially natural herd immunity, rather than vaccinated herd immunity? Protect us in this COVID-19 pandemic, in this COVID-19 epidemics. Vaccinated herd immunity, okay, it may be, but what about the natural herd immunity? How will it save us from these epidemics, from this pandemic? I will discuss this one by one. If I go the challenges or what are the contraventions in creating in developing herd immunity, if I say we know the more the infectious, the more the contagious of a disease, the greater the population immunity needed to ensure herd immunity. That is, the more the infectious, the more the contagious nature of a disease will have greater population immunity to ensure herd immunity. For example, if you say mumps is a very infectious disease, highly infectious disease, and it has a basic reproductive rate of 10 to 12, which means that in a population which is entirely susceptible, which is completely prehensile, meaning that no one is immune, no one is immune enough to the mumps virus, to the mumps disease. Every person who is infected by this mumps virus can pass the disease up to 10 to 12%. That is basic reproductive rate. That is mumps which has a basic reproductive rate of 10 to 12. This is like this. Another example, if we say measles, this is also very infectious in comparison to the mumps. That is, measles is also infectious and very contagious. And it has basic reproductive rate, RO, that is in abbreviation from RO, is about 18, which means that in a population which is susceptible, which is prehensile, meaning that no one is immune to the measles, not a single one is immune to the measles disease. Every person, everyone who is infected with this measles disease can pass the disease, will pass the measles disease on to 18 people. This is basic reproductive rate. In abbreviation it is called RO. The more the infectious of a disease, the greater the population immunity needed to ensure herd immunity. If we go in case of novel coronavirus, in case of SARS-CoV-2, severe acute respiratory syndrome coronavirus 2, the official name of the novel coronavirus, we know this is less infectious, less contagious in comparison to the mumps in comparison to the measles, and it has basic reproductive rate RO of roughly 2 to 3, which means that uh, uh, in a population which is totally susceptible, which is completely susceptible, which is wholly prehensile, meaning that no one of that population is immune to the novel coronavirus. No one, not a single one, is immune to the SARS-CoV-2. In that case, everyone, every person who is infected by the SARS-CoV-2, who is infected by the novel coronavirus, who is infected by the new coronavirus, can pass this coronavirus disease, can pass this COVID-19 up to 2 to 3 people, up to 3 people around. So this is all about the basic reproductive rate. Now if I go about the creating, about the saving phenomenon, about the protection phenomenon of the herd immunity. Why wouldn't herd immunity save us, protect us, defend us from the COVID-19 pandemic, from the COVID-19 epidemics? Actually, if I say it is very hard to predict anything. It is very difficult to say things in this corona pandemic. The matter that is true today is going to change in the next day, is becoming change in the next day. Everything regarding SARS-CoV-2, regarding the novel coronavirus, regarding this COVID-19 is changing so quickly, so hurriedly, so fast. The situation changes so much on a daily basis that everything we believed, that everything we thought is going to change after some days. The matter that you heard last week, the matter that you knew last week is becoming wrong by the end of the day. So it's very, very difficult to predict, very difficult to say. Things are changing so fast regarding this COVID-19, regarding this SARS-CoV-2, regarding this novel coronavirus. Things are changing so quickly. Even the solid certainties, even the solid certainties that we perceived, that we believed, that we conceived, that we thought, we were sure of, is going to change after some days. Is going to change day by day. For example, the basic reproductive rate and the symptoms and the incubation period of the novel coronavirus disease, I mean COVID-19, the key to making good quarantine, the key to having good hygiene, everything are suspected and needed to be reevaluated, needed to reassessed, needed to recount, needed to revalue again after some days regarding this novel coronavirus, regarding this novel coronavirus disease, regarding this SARS-CoV-2 disease, that is COVID-19. If I say herd immunity, without vaccination is by definition not a preventive measure. I'm saying again, herd immunity without a vaccine, without vaccination, is by definition not a preventive strategy, not a protective technique, not a defensive procedures. Uh, 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 this is reality. If I say again herd immunity that I mentioned, just to make it very clear about herd immunity, I have mentioned this herd immunity in my previous two videos. You know all those more better than me. Even I'm saying again, herd immunity. What is herd immunity? Herd immunity is an epidemiological concept that describes the state where a population, usually of people, is sufficiently immune to the disease that the disease will not spread within the population, within the community, within the society. If I say in case of SARS-CoV-2 disease, herd immunity is an epidemiological concept which explains the state where a population, usually of people, is sufficiently immune to the coronavirus infection, is sufficiently immune to the SARS-CoV-2, sufficiently immune to the novel coronavirus, that the infection will not spread within the population. In other words, if I want to make it more clear, in other words, enough people will not get the infection, enough people will not get the disease. I mean, enough people will not get the coronavirus disease, enough people will not get the COVID-19, either by vaccination or by natural immunity or by previous infection, that the people who are vulnerable, who are vulnerable, who are at risk will be protected. If I say again, the people who are vulnerable, I mean who are in medical condition, who are underlying medical condition, who are underlying pre-existing medical condition, who are suffering with some chronic diseases, who has a comorbidity of some diseases, for example renal dysfunction, for example hepatic dysfunction, for example cardiac dysfunction, asthma, if they have a history of stroke, if they have any history of heart attack, they are vulnerable, they are vulnerable, they are in a high risk population, and especially older adults, they are in high risk. So in other words, enough people will not get the infection either through vaccination or through natural immunity or from the previous infection, that the people who are vulnerable, that I have said, are protected. This is herd immunity. For example, that I have mentioned earlier in case of mumps. If we think about mumps, which has an estimated RO of 10 to 12 that I have mentioned, that in a population, which means that in a population which is totally susceptible, meaning that no one is immune to the mumps virus, every person who is infected to this mumps virus will spread this disease up to 10 to 12. This means that without vaccination, roughly 90 to 95% people, I'm saying with a basic reproductive rate of 10 to 12, it requires roughly 90 to 95% people to be immune to the disease, to be infected to the disease. The rest 5% will not get sick because when everyone else is immune to the disease, there is no one to catch the disease from. And this 5%, we can increase this number by vaccinating, because we know vaccination makes people immune to the disease. Vaccination makes people immune to the infection. And if we have enough people immune to the disease, immune to the infection, then it will stop spread the disease in the population. And this is herd immunity in a nutshell. For mumps, we need, I'm saying again, we need 90 to 95% people to be immune to the disease. Again, I am saying, for mumps, we need 90 to 95% people to be immune to the disease to stop spreading entirely. That is what is known as herd immunity threshold. Now, in case of COVID-19 is fortunately much less infectious, much less contagious in comparison to the mumps, with an estimated RO of roughly 3. With an estimated RO of roughly 3. I'm just making an explanation. With the RO 3, the proportion of the people who need to be infected with the RO 3, I mean basic reproductive 3, the proportion of the people who need to be infected, who need to be immune, is lower but still high, sitting at around 70% of the entire population. In case of mumps, it was 90 to 95%. But in case of COVID-19, though it's a low RO, I mean 3, the estimated people who need to be infected, who need to be immune, is lower but still high, because it engaging, it allocating about 70% of the total population. I will just make an idea what will happen if it is about 70% of the total population. And this is why, which brings us to why herd immunity, I mean natural herd immunity, be clear, don't be confused. Natural herd immunity, or from the previous infection, immunity acquired from the previous infection, could never be considered as a preventive strategy, as a preventive technique. If I say 70%, what will happen? What will be the scenario? What will be the situations? This is not a accurate number. I'm just giving an idea. If we count the total number of people in our country is 18 crore. So it may be more or less, not a discrete number. So don't be confused. Just giving an idea what will be happen in case of 70%. If 70% people are infected, if we open for natural immunity, natural herd immunity, what will happen? It will about 12 crore 60 lakh people should be infected to get natural herd immunity. So it's not a matter of joke. It's not a matter of joy. So if we consider fatality rate, if we consider mortality rate, now we have around 1.3%. mortality rate. So 70%, I mean 12 crore 60 lakh people. From them 1.3% is about 16 lakh 38,000 people. So if we allow natural herd immunity to be achieved, 70% people, I mean 12 crore 60 lakh people, 1.3% from them, about 16 lakh 38,000 people will die. We will allow to die 16 lakh people, 16 lakh and 38,000. This is about fatality or mortality rate, considering 1.3. But if we consider the world mortality rate, according to WHO, it is about 5 and more than 5. If it is 5%, it will be 63 lakh people out of 12 crore 60 lakh. And it will be 63 lakhs. And if we consider 4%, it will be 50 lakh 40,000 people will be allowed to die. So very catastrophic, very disastrous, very pernicious. If we consider the hospitalization rate, we are simply saying it requires about 10 to 15% people requires hospitalization. If it is 10%, out of 12 crore 60 lakh people, it is about 1 crore 26 lakh people needed to be hospitalized. If it is 15%, it will be 1 crore 89 lakh people. So it will be overburdened for our hospital. Total hospital condition, total healthcare system will be ruptured, will be broken down if we allow natural herd immunity without vaccination. And we are saying about 3 to 5% people requires ICU support. If it is 3% out of 12 crore 60 lakh people who are infected due to achieving natural herd immunity, if it is 3%, it is about 37 lakh 80,000 people. 37 lakh 80,000 people will require ICU support and ventilation. If it is 5%, it is again 63 lakh people. So is it possible? Is it effective to allow natural herd immunity? It's simply catastrophic. It's simply a disastrous situation. It's a fatal situation. It will be a deadly situation. If I say it will be a viral situation, it will be a baneful situation if we allow natural herd immunity, if we allow herd immunity without vaccination. So this is why I am again saying, this is why, which brings us to why, that is why herd immunity is generally pursued through vaccination program. This is why herd immunity is normally executed through vaccination program. If I say again, this is the cause, are the reasons that herd immunity is usually ensured, is usually succeeded, is usually imitated through vaccination program. I mean, okay, fine, we will allow herd immunity, but this should be through a vaccine. This should be through a vaccination program. Without vaccination, without a vaccine, if we allow our people to be immune, to achieve natural herd immunity, after surviving infection, through surviving infection, is quite impossible. It's simply a catastrophic situation. It will be simply a hazardous situation. It will simply be a pernicious situation. It will simply be a disastrous situation for our total healthcare system, for our total hospital management. So be careful, be informed, stay protected, stay secured. So number today, I will come again about the vaccinated herd immunity, and to make about natural herd immunity, which one is better, and which are the consequences even in case of vaccinated herd immunity. So listen to me, watch my video. It will be helpful for you to understand. I'm acknowledging that you are quite capable. You know a lot. You know more than me, but it will help you, I think. So no more today, more when I meet again with another important aspect of herd immunity, inshallah.